just jazz for our conversation this evening. Super excited to have Olusegun Ishmael with us. And here's a little bit about what we're going to talk about. This episode explores a critical shift in healthcare delivery. Olusegun is founder of Mira Health. Mira Health is moving the global paradigm from acute episodic care, a model that's largely been unchanged since the time of Hippocrates 2,400 years ago, to continuous proactive engagement. So we'll unpack Olusegun's personal and professional journey, his physician-driven motivations to solve patient noncompliance, and the development of Mira's AI copilot that makes this continuous health support idea accessible to everyone, irrespective of socioeconomic status. So welcome, Olusegun.
Thanks, Aaron. Thanks, Amy. Great to talk with you guys tonight.
Yeah, same. Last time we spoke, you were traveling all across Europe.
Yeah, I was spending a week with each kid. We've went from through 4 countries, the UK, Italy, France, Switzerland.
All the good ones.
All the good ones.
Thanks for that, Amy. That's incredible. And you are very well traveled and just have such a rich background. So maybe ground us in that before we really dig into some of the topics that we have on deck tonight. Tell us a little bit about where you come from and some of the early experiences that shaped you.
So I'm going to take it way back. Remember that cartoon comic, the little dog and the wore glasses? He says the Wayback Machine. So I'm going to do the Wayback Machine. Yes. We're taking way back. So I actually came to the States when I was just about to become 5. Didn't speak English. My parents came to the States for college. My dad did his master's in Chicago. But it was an interesting mindset to go from a kid who didn't speak English in a third world country to overnight and in 6 months was supposed to be in kindergarten in Chicago. Totally a whole mindset change.
From world.
So I credit Sesame Street and Electric Company for quickly getting up to speed with English. So I'm truly a fan of PBS, the public's NPR, and all the public broadcasting system. Fast forward, at 13, my dad decided he wanted to give back to his country of birth. We went back to Nigeria. So once again, another major paradigm shift, because I'm like, okay, what are we doing? Going from a first world country back to a third world country. But it was great experience. Finished high school in Nigeria, then subsequently went to medical school. And one of the key things that hit me while I was there compared to the States is medical school was free. And I'm like, you're in a third world country and they're paying for your medical education. And coming from a first world country, one of the richest countries in the world, and you end up in debt to go to college and get your education. I'm like, so there's something wrong with the world here.
Yeah.
But the experience for me from a medical perspective was then coming back home to the States, getting training in family medicine in Gary, Indiana, and then subsequently getting my MBA because I really wanted to know how do we pay for healthcare? How does this thing generate money? From getting my MBA, I also got a fellowship in how do we train physicians, how do we train medical students, et cetera. Fast forward from there, work for multiple insurance companies. So I'm like, okay, first-hand experience of how this thing called healthcare generates trillions of dollars every year. Then from there, I went to group practice, and then from group practice as an administrator, then subsequently to hospital administration. And then, okay, this whole model of healthcare for me wasn't working. I'm like, this doesn't make sense. So got a patent on a component of the tech that we built. And then now today, I spent the last 1 year building this healthcare platform. Just looking at the fact that everywhere you go, everywhere in the world, everybody has a smartphone in their hand. So I try to say, what is the data? So I think right now we're about 90 plus people around the world have a smartphone device.
Yeah.
And then and the expense has gotten cheaper and cheaper compared to, I remember when it first came out and it was like the size of a suitcase
Oh,
with
yeah.
just a brick.
Yeah.
Um, yeah, everybody's walking around with this leather bag and
Yeah, it's
with
true.
this brick.
Yeah, my granddad had one. It was pretty wild. You could really hurt
And then
someone
you
with that.
fast forward and you're like, okay, what is this thing that we now hold? Everybody holds in their hands. And then with the advent of AI, I'm like, okay, we are at the perfect moment to change the model of healthcare. So that's been my journey, really from experience in healthcare in multiple different countries, multiple and leading in multiple different settings from academia. Because technically, I believe I'm still a clinical assistant professor at IU and Indiana University, to managed care to hospital administration. So really, gotten a lot of pieces of healthcare under my belt.
Yeah.
Yeah, absolutely. I think it's a really unique perspective. And I don't know that there's really anyone who's not sold on healthcare is maybe too much or likely too much about shareholder value and not enough about patient care. Certainly, I sometimes wonder where my monthly premiums go when I have to go pay for care again at point of care, point of service. So I don't know that we need to spend a ton of time on that. But what I'm really curious about, you mentioned patient noncompliance, and I think that's definitely real for a lot of people, finding it really hard to follow instructions or make lifestyle changes for the good of their own health. But tell us a little bit about, from the point of view of a physician, when you were in that seat, what did it feel like to interact with patients who were non-compliant and suffered as a result?
So it's interesting because I always use it when I teach the residents, and even now when I'm helping our inpatient service, we as physicians are trained to be very paternalistic. We feel like we're supposed to tell you everything you're supposed to do. It's like, Aaron, you're supposed to do A, B, C, D, and E. Amy, you're supposed to do, and it's like, wait, but guys, compliance also starts from health literacy. And if
Mm.
we're not explaining to patients and patients don't get it, so for example, I have this, and this is a classic reason why, this is the main reason why I was an impetus for getting my patent initially. I have this 75-year-old woman in rural Indiana comes in, and I'm like, okay, didn't we just see you a couple weeks ago? And I'm in the ER. And she's like, yeah. I said, okay, can we see your medication? And she literally brings out a bag of medications, a grocery bag, and dumps it. And I'm like, so you spend the whole day taking medications, basically. She laughs and says, yeah, she's short of breath. So she's in congestive heart failure because she hasn't been taking her medications appropriately. But there's so many of them that we've written over time, and some are actually duplicates of the same medications, and she's
Oh, wow.
unaware. So one, that's part of the health literacy. She doesn't know why she's taking a medication and for what reason she's taking it and what the impact or of taking it or overtaking or not taking it is going to be. So that's the first thing in
Mhm.
compliance is health literacy. And then the issue then follows is that as patients are doing things, we need to explain to them what is the disease process. So I explain hypertension to people by saying, let's say I am supposed to push, and then we talked about I have a pug. If I'm supposed to push my pug, it takes no effort. I mean, she weighs 18 pounds. Now, if I'm supposed to push an elephant, that's going to be a whole different, that's a kind of lot of more work. I said, okay, and then let's take another example. Let's say hypothetically, we take a garden hose, connect it to your wall at your house outdoors, but take that same garden hose and connect it to a fire hydrant.
Mm.
I said, so your elephant and the fire hydrant is your high blood pressure. It's that
Mhm.
elevated blood pressure. From
Yeah.
the fire hydrant perspective, that tube, your blood vessel, is not going to be able to sustain that kind of pressure for too long. It's either going to explode, it's going to tear, something's going to happen. From the example of using the elephant and pushing it, that's a lot of work on your heart trying to push through that pressure. I said, so then people are like, oh, so when you tell me I have hypertension, high blood pressure, now I get the consequences of my heart is having to work a lot. So the heart eventually could fail. If the example of the blood vessel with the garden hose could cause a bleed in my brain, it could also damage my kidneys and other organs. So people are like, oh, I get it.
Yeah.
So now it's easier for them to be compliant because now they realize the impact of not doing what they're supposed to be doing.
Yeah.
So I think that's the way I look at compliance. I've had a patient, for example, in her 40s, because she's felt a lump and she's like, I'm going to ignore this. Fast forward, she shows up in advanced stage of breast cancer. Then we have to do a mastectomy. She goes into acute depression because in the culture that she comes from, she no longer feels like she's a woman without the breast. Her breast is gone. So now we've gone from a fully functional professional female who is now in acute depression, lost the breast, potential, it spread to the lymph nodes, so there's a potential spread. So from something that maybe we could not prevent, but we could have caught early enough if she knew, like, okay, I feel something that doesn't feel like it's supposed to be there, and going to see her doc. And part of the compliance issue is also the access issue. So we start from health literacy, compliance, and then being able to have access. So I've worked in rural hospitals around the United States where you can't get a cardiologist, you can't get a urologist, you can't get specialties in those rural hospitals in a timely manner. So there's an access issue. So all of those play into the whole healthcare paradigm. So what we're trying to do is create that health literacy and make the patient actually be their own advocate. So, and question the doctor and say, hey, Dr. Ish, what am I? You tell me I'm supposed to do this, but why? And when I say something, they say, why and why until they fully comprehend, like, okay, this is what we're supposed to be doing. So that's the way I look at it.
How often do patients, in your experience, ask why or ask for things to be explained? Because I don't know if it's just me or a generational thing or whatever, but I just sit there, listen. I'm like, yeah, okay. And then I don't have any questions because I don't know what I don't know. So I'm just like, thank you.
So,
And then that's it.
so you hit the nail on the head. Give you a personal example. I'm teaching because used to be faculty, so I'm teaching residents, and I'm standing in the room as a resident is actually interviewing and taking a history from a patient. The doctor walks out to go get the prescription off the printer, and that was the day before electronic prescribing. So he leaves the room, and I'm like, someone, Mrs. Smith, we're going to use Mrs. Smith. Mrs. Smith, what did he say? And she's like, I don't know. I said, but why are you smiling and nodding at him like you get it? And she's like, he wasn't talking with me. He was talking to me. So I'm like, okay. And he's a doctor. So
He
just,
knows. That's the main thing.
so,
He knows.
and he says, I'm going to take the prescription. And she's nodding. So one of the things I've always encouraged my medical students and residents is if you tell a patient something, ask them to regurgitate it back to you.
So smart. Yeah.
So if I say, Aaron, this, and that, I'm like, so Aaron, so what is the plan now? What are we going to do? And why are we doing this? So that helps to begin I'm not sure what I don't know.
Yeah, because you're starting to get informed.
Exactly.
Yeah.
So part of that is the health literacy that we were talking about.
Yeah, because it's just not there actually in your normal everyday experience. You know, they're busy, you're in and out. I don't know if this is for everyone, but you know, when you go for your physical, the doctor comes in for a very brief moment of time. You have a nurse that checks all the blood pressure and this, that, and the other, and I still couldn't tell you, by the way, what the numbers mean. Like they tell me, like, your blood pressure is this, and I'm like, okay. They're not wheeling me away, so I'm guessing it's okay. And then
you should ask.
You should ask. I'm hearing you say this, and I'm like, why have I never been like, okay, but what does that mean? Like, I'm in
It's
my
like you should
40s.
say, what does the top number mean? What does the bottom number mean?
Yeah.
And what should it be? And why?
Instead, I just go, yep,
Yep.
thank
Thanks for
you.
telling me that.
But then the
So,
doctor's in there for a hot minute, and it's quick, 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 and then gone, and you're like, okay.
and that's where I've coined the term the in between when you're well and when you're sick. That's
Yeah.
where I feel is a sweet spot of the in between. So when we say know your numbers, it's like, okay, my blood pressure is 120 over 60. Okay, it's normal, but what does that mean?
Yeah.
So that's the in between where we want our tool, Mira, I call
Educate.
her, we want her to be able to explain to you, like, oh, what does that 120 mean? It means
Yeah.
that when your heart squeezes and pushing the blood out, that's your top number. When your heart relaxes and it's not pushing it out, that's your bottom number. So, real simple. So, you can
Yeah.
understand that. It's like a pump. Your heart is a pump. When it squeezes, pushes blood out, that's a higher number. And you need a certain amount of that push out. So, let's say your body is a high rise and you got the pump that pumps water, the water pump in the
Mhm.
basement. You need a certain amount of pressure from that water pump to reach the penthouse.
Yes.
So if
Yes.
your blood pressure is low, that top number is too low, you don't get enough blood flow to your brain. So if you feel dizzy
Oh.
or you're older and you stand up suddenly, so that pump is trying to catch up to raise it because now you're
Define
going from
older, because that definitely
52.
happens to me. Like,
So I tell women that you don't get older, you get better. You're like wine.
yes,
You get
yeah,
better with age.
sipping like a fine wine over
Right?
here while I'm getting dizzy standing up too fast.
I want to go back. I am thinking about your first example, Olusegun, that you shared about the 75-year-old woman and hypertension. Maybe just the education piece is bringing me back there. But we talked about this paradigm of people just going to the doctor when they're really sick and not paying a lot of attention in between from when they're feeling well and all the space between those 2 points. In the example that you shared, what would good have looked like for that
Mm,
patient to take more control in between?
So good for her. So she comes in for congestive heart failure. So basically, her heart isn't pumping and reaching all her organs. And it typically shows up in shortness of breath,
mhm,
or her legs are swelling,
mhm,
or she feels like I get easily when I eat, I get easily full. So the kinds of lots of little nuances that she can begin to understand. So in an ideal world, when we discharge her with all her meds, it's like, okay, Mrs. Smith, this does that, this does this. These are the side effects. And say, okay, Mrs. Smith, so this pill, what does it do and how does it affect you? So she goes home in an ideal world, because we don't have enough people to be making phone calls to every Mrs. Smith that we discharge, but
mhm.
we look at what we're trying to build at Mira is Mira would say, oh, Mrs. Smith, you just got discharged from the hospital with congestive heart failure. So the next day is going to ask her, how are you feeling? Are you short of breath? Do you feel like it's harder for you to walk the same distance that you did when you got discharged? And if at any point in time she says, yeah, I'm getting more short of breath. So we know that maybe her lungs are filling up with fluids.
Mhm.
Mrs. Smith, you got discharged. Let's get you to make sure that you weigh yourself every day. And automatically from her scale, it sends it to Mira and says, Mrs. Smith, you've gained 2 pounds. You're saying you're further short of breath. Why don't we send a message to your doctor? And it may be something as simple as, have you been taking your medication? Because part of what Mira is going to be doing is
Reminding them to
reminding her to take her
take.
meds every day. But
Yeah.
let's say she is taking her meds and things are still not going. Send a message to her care provider team and who says, why don't you double up on your diuretic, your water pill today
Mhm.
to get some of that excess fluid out of your system?
And that
Because
could make a real difference so that
yeah, exactly. So that in
she
between
probably
begins to
wouldn't.
lengthen.
Yeah. because she probably wouldn't have called a doctor to say,
Nope.
I'm this today. And so it just gets worse and worse and worse until sat in the office. Yeah, I think this is genius, honestly, because how do I say this politely? In a lot of ways, as
You're
technology
amongst friends.
as technology has advanced, we've got a little stupid about things that we shouldn't be. And I think having something available to help you track my medications, because it's all well and good having the little like pill boxes,
Your
but like,
box.
that's only goes so far. And so I think about like all those little nuances about like weighing yourself, or, how are you just checking in with yourself, like how you feel, to gauge whether those meds are working. But then what did also strike me, sorry, I'm like getting very obsessed with this whole thing, but when you ask the doctor, say you do have like a grocery bag full of medication, and you've done the right thing, you've asked the doctor, they don't have time for you to sit and write that all down and what it all means. So would that all be in the app too, that you could just look up the medication and be like, oh, this is what it is?
So our ultimate goal is that if you are on 5 medications, it will list what the medications are. It will tell you what they're doing, give you side effects. And the goal is the AI component would also begin to query you about potential side effects
Mm.
and say, so Mrs. Smith, do you know you're diuretic? You may be losing potassium. Are you taking your potassium pills? Or
Mhm.
maybe you need to go get a banana today. Eat an extra banana.
I
Because
love
are you getting cramps in your legs? Which may be one of the first things that she's going to notice, that, God, I feel like my legs are cramping up. And it's like,
Mhm.
hey, maybe you want to talk to your doctor about getting your potassium checked. So we envision a system where in 2, 3 years, it actually is having a full on conversation with you. To your point, we've become so addicted to our technology, and it's kind of made
Mhm.
us but how about the technology actually makes us smarter
Yeah.
and more engaged with our health? Because what I've always told patients is, and, and this is no disrespect to people, I am your doctor, but I don't own your body. You own your body.
Yeah.
You should own your health. Just like when I take my car into the shop, the guy fixing my car, he's like, it's not my car, it's your car.
Yeah.
I mean, whatever happens, I leave that shop, it's my car. And
Yeah.
when you leave the doctor's office, you should begin to take ownership of your body and your health. And I think that's ultimately what we want people to begin to do, is take
Yeah.
ownership. But to your point, doctors don't have, I mean, I got 10, 15 minutes with you.
Yeah.
I've
And
had
you hear
patients
that.
come in and say, thank you, Dr. Ish, for helping me. And I'm like, okay, let's be honest here. I spent 10 minutes with you, 15. I said, the nurses actually spent more time with you than I did. So why don't you thank them
Yeah.
rather than
They
thanking
do
me?
schedule you like pretty aggressively. Is that why you have to like go around like that? Like, how many appointments is there going on at one time? It's a total
So the thing
sidebar.
about it is, I remember when managed care first started, you had a certain number of patients you had to see.
Mhm.
Even now, as an administrator in the health system, you're like, okay, Dr. X needs to see a certain amount of patients every day to make his volume and his productivity. So we're all on this rat race and this
Mm,
hamster wheel and spinning it. But part of it is, how do we maintain quality and still be productive?
yeah.
Also knowing that we don't have enough healthcare providers, whether it's nurses, physicians, physical therapists, respiratory therapists, we don't have enough healthcare providers, and we're not doing anything immediate to tackle the immediate
Address.
problem or even in
Mm,
a long-term problem. So
yeah. Like you said, it's just so expensive to go down that route if you're in college, for sure. Something that you just talked about, which I'm also interested in, is the addiction to cell phones, and everything's got to be made fun for our like simple minds. So, was there any thought around like gamification or like sharing in your app?
So one of the things we wanted people to be able to do is create their own community. So, for example, you and Aaron could create your own little community. So if you're on a certain medication and Aaron's on a certain medication, so when you're notified to take your medication, so I took my medication. Aaron could be. You can say, I want Aaron to be my partner in this, or you can create your spouse as your partner and say,
Probably be more reliable to ask Aaron.
exactly. And and I learned this from two situations. One is when I have specifically men. When men come in, I said, "Can I speak to your spouse?" And I make the spouse responsible. I said, because John is not going to do what he wants to do. So
No, John's not going to
John
remember
is
a
supposed
single
to do
word.
exactly. John is supposed to do A, B, C, D, and E. So I want you to, and if John is not going to do it, I want to make sure you have good life insurance on him. So when he does
Yeah.
kick the bucket, at least you're taken care of.
Yeah. Yeah.
So and then I remember a professor of mine once say, always find a secondary gain for patients. So, John, would you like to walk your daughter down the aisle, or would you like her to wheel you down the aisle when she gets married? So, so, so those are the kind of
Wow.
things that. So we created a situation where you can create your own community. And the other piece about what drove that was when we first did our initial beta test. One of the
Mhm.
users, she said, my dad lives in Arizona on his own. He wanted warmer weather than Chicago. And she's
Mhm.
like, so when he gets notified, can I get notified? So those were kind of the things about creating your own personal community. But what we also thought about is creating a bigger community in the Mira spaces. For every question you answer or for everything you do, you get a certain amount of points.
Mm.
So then so you and Aaron, for example, can be, you may not even know who Aaron, you may not know who Amy is, but Amy is about the same age as me. She's female, but she's got 200 points and I only had 10. What's going on here? And then you're like, well, she's had her mammogram, she's had a pap smear, she's had her blood work, she knows her blood pressure, she's had her annual physical, she's had her vaccines are up to date, and you're like, oh, okay. And human beings being competitive, you're like, okay, what do I need to do to get that? Or why do I need to do to move up? With the ultimate thing that even insurance companies, I remember when I worked for an insurance company, we used to also send gift cards to people when they did certain things. So that is the ultimate goal, is that when we create those point system, can you now translate those points to real world? But even people play Pokemon for points,
Oh, I know.
and they were walking into the middle of traffic.
I know. Trying to catch something that's not there.
Exactly. So if people would chase Pokemon for points, let's at least get them to chase their healthcare for
Generally good
points.
health. Yeah.
Yeah,
That's
exactly.
all we're asking. Just take care of yourself so you can
So
enjoy life.
exactly.
It's genius. And a tech company needs to solve this, because I will say, I've seen a couple of attempts to do something similar from insurance providers. And most recently, my insurance provider shared with me some sort of gamification opportunity. And I clicked on the link, and the link was just broken. And so it's just like,
But the thought was there.
it was a nice thought, but insurance provider attempts to build engaging application didn't go so well in this case. So,
And you're
right.
100% right. And that's, so the other point is, it's not just a tech company, but you want a tech company that has provider involvement. So one of the advisors I have on the team is a geriatrician. She's a professor of geriatrics, because I know as a population is aging, they're going to be a core part of our population that we expect to be using this. But we also got to make it usable for that population. Is it the visibility? Is how do they interact with the UX? So you want providers to be engaged in it. You want the tech company to understand the technology and the coding. So as I'm sitting with my chief technology guy, the CTO, and I'm explaining it, he's like, "Ish, that doesn't make sense." So now I have to break it down to him. And then he's like, I get what you're trying to do now. So then he translates what I'm trying to do into that language.
Yeah.
So it's an interplay of multiple people coming in. And then we also have, users who are like, nah, that doesn't make sense. I wouldn't do that. Or
That's
like your point, the link doesn't work.
Yeah. Yeah.
Like, okay, I can't get in. The link doesn't work. It's too complicated. It's too
Yeah.
many steps to do
People
ABC.
do give up very easily too.
Yeah.
But
I gave up immediately. Yeah.
Yeah, because that's the society, the world we live in. We are a fast food society. We want immediate gratification. So if it's not easy, we're not going to do it.
I'm going to do it. I just think about, my family and, my grandma, she's in her 80s, but she can scroll Facebook all day long. So she's not struggling with the phone. But how nice it would be for me in Chicago and my mum who lives in London and my aunt who lives up in Yorkshire, who's not too far away, but the rest of us are all so dispersed. It would be so nice if we had a way to be like, okay, grandma's doing okay at the minute.
Yeah.
That's good to know. Like that would just make me feel better. So I think it's a
And
really great thing.
yeah, you said it perfectly, because we were doing a pitch for interns at Illinois Institute of Technology, IIT, and this guy came up, one of the students, he says, I wish my dad had this in India. I'm like, why? He's like, because he's in a hospital, because he hasn't been taking his medication. He hasn't been doing what the doctor tells him. So if I knew he wasn't, I could call him. And when I talk, he's like, I talk to him at least every other day. And like, so Dad, why are you not doing what you're supposed to do? And he's like, why? What do you mean? Because I know, because the system is telling me you're not doing what you're supposed to do.
Right. Because, we just assume. Such great conversation with Dr. Ish this evening. And if anybody out there is interested in learning more, you can follow Dr. Ish on LinkedIn, pop his name in the search bar, and you can connect with him there and follow Mira Health for more updates. Thank you.